on the issue of black mental health, there's a long and inglorious history of treatment of black people in black and mental health. And the institutionalised racism that is within this arena of psychiatry and mental health services is legendary in our communities. I remember Orville Blackwood, I worked on the Sean Rigg thing, I understand all of the issues and the Rocky Bennetts and so on. I've seen recommendation after recommendation come out. I've seen the numbers continue to increase in the number of young black people that are diagnosed. When I was in the Mayor's office, I took the time to visit every secure mental health institution in London. And when I opened them, it looked to me immediately struck by these solid ranks of young black people, young black men and women in the most secure hospitals. And it struck me as a slave galley of a slave ship, because it was almost entirely black. And everyone I went through, whether it was St Anne's or whether it was just up the road there, it was the same repetitive thing. Open the locked door, what do I see? Rows of young black people in mental health institutions. And so the institutionalised racism, as it affects diagnosis, I think the point the guy was making about the statistics is very important. But also then there's the socio-economic conditions that give rise to mental health issues. And they're all on the rise in Lambeth. I mean, we can talk about, the value of having culturally appropriate services so that black people feel comfortable in early presentation of their illness, but at the same time, local authorities closing down black mental health projects. At the same time, black unemployment in the borough is rising at an incredibly fast rate. At the same time, poverty and family poverty and poverty amongst young people in the borough is on the increase. At the same time, we're looking at the gentrification of Brixton right before our eyes. And therefore the opportunities for people to start businesses, get themselves on the first rung of the ladder, are all being denied to them. And then you come to the issue of the police's response to black people, which in essence has sort of now become so caricatured that almost every black man is approached as a potential mental health suspect in some way or another. And the protocols around arrest and intervention of the police and people like Sean Rigg and Rocky Bennett, all of these issues have been outlined for years, and we know the recommendations that they put forward. The problem is the absolute unwillingness of the profession of psychiatry to admit the existence of institutionalised racism is affecting its treatment and diagnosis and medication and detention of black people, and the abandonment of the Metropolitan Police in believing that they're an institutionally racist organisation, which means the disproportionate number of black men who end up injured and dead and wrongly committed by police officers under Section 136 is on the increase. And so these are very difficult times for our communities. Just before we go, I think two things. One, have got to be realised. One is the history of Lambeth Council's partnership with black communities on anything at all, any initiative. It's one of complete and utter failure, as far as I can see it. There's been very few, if any, real substantive initiatives taken forward. The last commission we had was the Commission on Gangs and Guns. And I see Lorna Campbell sitting at the back, who was the councillor who chaired it. It took extensive evidence on the issue of violence. It produced a fantastic report. It developed recommendations that I thought were on point and could make a real difference to people's lives. And that commission recommendation, like most others, lies collecting dust on the shelves in some library somewhere and has not been implemented. So what I'm saying is, from time to time, we get re-representations of people coming saying, yes, I understand the problem, we're going to have a new commission, it's all going to be different from here on in, they're here for a little while, they go, they're replaced by somebody else who tells us the same story over again. One thing is certain, that the situation becomes worse year by year, despite what we're being told about best efforts of people wanting to engage and help with us. So I just want to put that sort of health warning, literally, on what's being said. The other thing is, we're trying to improve health services at a time when the National Health Service is under the most fundamental assault we've ever seen in our lifetime. It is not even recognisable in parts in some of the developments we've seen by the coalition government in relation to the reform of the health service, which we were promised would not happen, but now we're seeing the most radical top-down reorganisation we've seen despite Cameron's promises. And then on top of that, we've got GP counselling groups, commissioning groups, who are being brought together. So the whole health system has become deeply fragmented at a time when we're trying to get an improved response out of it. In relation to black mental health. And what I'm saying is, and I perfectly accept that Ed's coming out with the absolute best of intention. This is nothing personal, Ed, but it's about the lived experience of black communities in this borough who get presented with new silver bullet, new platforms, new projects that are designed to meet their needs, all singing, all dancing, and then are left in exactly the same position watching their communities continue to deteriorate down that line. So whilst your commission is doing what it's doing, I'm afraid it's set against the backdrop of rising youth unemployment, rising adult unemployment. We've got closure of mental health projects that were previously culturally competent to help Somali communities, Nigerian communities, Jamaican communities in their distinct cultural frameworks. And we're watching the retreat of services being cut by the coalition government and the Labour Authority here, who, in my view, are going along with the cuts. I mean, I don't think we're putting up enough of a fight against them. I applaud the stance against the fire service closures, but quite frankly, when this council is disproportionately sacking black women in terms of the employment and public sector, increasing black youth unemployment, black health unemployment, you're creating the conditions for more mental health issues, not less. And all of the sort of window dressing of a mental health commission is not going to really change that.